There's a new global effort to combat antibiotic-resistant superbugs. Britain's Prime Minister David Cameron made this big announcement yesterday, saying he has the support of President Obama and German Chancellor Angela Merkel. CBS 11's medical expert, Dr. Crystal Foster, is in the studio with us this morning. So this kind of superbug, first of all, what kind of infections could become resistant?
So we already see urinary tract infections that have multi-drug resistance, skin infections, even gastrointestinal tract infections. But you could even see something as simple as strep throat become resistant in the future to antibiotics.
And are children the most likely victims of these superbugs?
No, everyone is. It has no age discrimination at all. Elderly, normal, healthy adults, and children.
And why is it a global effort?
It's a global problem because it's not just something that happens on the national scale. So, for instance, there are developing countries that have antibiotics over the counter that people can buy, and not every infection needs antibiotics. So the problem is, not only do we need to develop new drugs to fight these already resistant antibiotic or bacteria, but we also need to educate the whole world on how to properly use antibiotics. There are a lot of infections. The common cold is caused by a virus. Viruses don't respond to antibiotics. And a lot of overuse and misuse of antibiotics is the reason we're in this position in the first place.
I was going to say, because this is a much larger conversation about how often people are prescribed antibiotics, how often people take them.
Exactly.
But what should families do right now? I mean, what's the realistic approach to this conversation?
Talk to your doctor. Anytime you get sick, ask your doctor, is this antibiotic really necessary? Do you think I strongly have a bacteria, or is this a virus? How long should I wait before I decide to take the antibiotic? And if they are prescribed an antibiotic for a bacterial infection, take it the way it was prescribed.
Right.
Don't save some pills for later and think you'll treat an infection later on.
Yeah, don't save it and treat some other condition that you have not seen a doctor for.
Exactly.
Okay. All right. Always good to see you.
Oh, thank you.
And if we don't see you before you have the baby, congratulations.
Thank you.
You look beautiful.